For families, the pandemic has been a severe challenge, especially when it comes to ensuring that newborns and babies receive all the care they need to thrive. So with me today, I have Dr. Britta Hüning, a pediatrician and neonatologist at the University Hospital Essen in Germany. So welcome, Dr. Hüning, and thank you for being with us today.
Yes, thank you for having me.
Why is it so important that parents and their children keep to these follow-up appointments? Why do parents still need to go, even though there's a pandemic raging? And
well, first of all, the pandemic goes on for 30 months now, I think. We are not so optimistic that it will end very soon. So that's the first point. So we have to provide care for the babies and the families. On the other hand, we all know that preterm babies are at high risk of developmental problems. The earlier they are born, the higher the risk. And the risk can be in multiple domains. So it can be motor problems, cognitive problems, speech, behavior, and so on. And well, since we have substantial progress in neonatology and perinatal care, we don't have the biggest fear of cerebral palsy like we had the last decades. But what is more and more clear is that our preterm babies, when they grow up, they have tiny, minor problems, but in multiple domains. So what we really have to do, and why follow-up visits in a follow-up clinic are so important, is that we have to go with the family through all these developmental milestones a child has to or will achieve. And if we find a small problem, we want to find it as soon as possible so that we might offer potential and targeted intervention for these babies. And we have our guidelines, we have the international guidelines, we have the guidelines the EFCNI promoted. So we know that early diagnosis and early intervention is the way we want to go. And the overall goal, of course, is to maximize the outcome of our tiny babies, right?
What can I do if I'm a parent and I have a child or newborn that needs more help, more care? How can I go about scheduling or planning these follow-up appointments and the follow-up care in a way that is still safe, so that my family and my child remain safe?
Yeah, I think most of my colleagues made plans and have some standards in place after 30 months of the pandemic, so they know exactly what to do to protect their patients. But to be sure, just give them a call. The worst thing to do is to just cancel the appointment, I would say. So ask your follow-up clinic, what are the plans? Do you have a digital alternative, for example? So it's possible to examine a baby, except for reflexes, that's not possible. But we can show the parents in the camera we have a puppet and they have their baby, what they have to do, and we get very good insight into development, and also for older children. And there are other possibilities. For example, there are good questionnaires that help us screen our patients. So we send the questionnaire to the parents, and if they reach a certain amount of points, then we know, okay, it's better to have that baby here in our follow-up clinic. And all the others, we can see, we have the video consultation. And of course, there's also the pediatrician who knows the baby very well, or the child very well. So ask him or her as well for their advice. But really, my biggest advice is don't cancel the appointment before you have a plan B.
Okay, thank you. I think the gist, or what I'm really getting from what you're saying, is that it's ever more important that parents and healthcare professionals really communicate with each other. Also, parents are treated as important caretakers of their children or their baby. They are important input, and they can help. They can be equal caretakers in a way.
Parents are biggest part. They know the baby much better than anybody else. So what can we do without parents? So that's for me, it's the most important part in the whole judgment of a baby. Yeah, definitely.
Thank you so much for your time and for your input. That was Dr. Britta Hüning from the University Hospital in Essen. Thank you.
Thank you. Goodbye.